Welcome back, you beautiful souls. Thank you so much for joining us. Welcome back to you too, man.
Good to be back, sir. Thank you very much.
This is a vitally important conversation. I think so many parents will undoubtedly grapple with this at some point, and there is always this fear. But there is a vitally important day of awareness tomorrow. It is National Attention Deficit Hyperactivity Disorder Day, or ADHD Day, with the aim of raising awareness around this disorder and how we can deal with it. Now, ADHD is a very common disorder which affects children and adults, and here to tell us a little bit more about it is a beautiful panel this morning. It's our psychiatrist, Dr. Laura Comrie, educational psychologist, Danielle Douglas, and Dr. Michele Van Zaghi. Doctor, guys, welcome to it.
It's great to have you with us, and thank you so much for taking the time to weigh in on this very important topic. And perhaps we can start off from the basic point of view by defining what exactly ADHD is, Daniela.
Okay. So it's a neurodevelopmental disorder, which means that it's brain-based, and it can occur typically in childhood, but it doesn't mean that adolescents and adults are just not as equally affected. It does seem to affect more boys than girls, but that doesn't mean that girls are not being affected. I think that in terms of their presentation, they present very differently, slightly differently. So perhaps we're missing them as well. And the sort of the overarching difficulties is difficulties with attention, so struggling to focus, struggling to follow instructions, being hyperactive, so lots of movement-seeking behaviors, and then being impulsive, so struggling to regulate their behavior and their emotions as well.
So much of that kind of feels like the human condition. I kind of feel like we are all on a spectrum of sorts, and there are obviously factors that weigh in and influence us in that sense, and then we're dealing with our kind of genetic material. But I'm going to ask another very simple question. Maybe, Laura, I can put this to you. ADD versus ADHD, what are the core differences?
The disorder is actually called ADHD, and I think ADD is a misnomer. So with ADHD, there are different subtypes. You've got the inattentive subtype, and then you've got the hyperactive impulsive subtype, and then you've got the combined subtype.
Okay.
So ADD is really the inattentive subtype. So we see more of the inattentive subtype in girls. I think, girls are more trained maybe in the schooling system, or just, in their gender roles to sit still, be quiet, ladylike. And they often internalize their hyperactivity. So they feel quite restless inside, maybe, fidgeting on their chair rather than jumping up. And I think that girls, it's twice as more common in boys than girls, but I have a feeling that it's probably more similar, and we're just not picking it up. So the ADD is the inattentive subtype. A lot of the time we see the combined. It's not unfortunately as clear-cut as we would like it to be.
But we love to, with these sorts of things, we love to paint it with one brush and classify it.
Yeah,
exactly.
There we go.
And perhaps all too quickly, parents might be at a stage where they jump to conclusions, because you've just mentioned a couple of things that they identify in their children. Oh, my child has this. Let's talk about professionally, Dr. Van Zaghi, how ADHD is diagnosed.
So I think, like we're all saying, all of these psychiatric brain disorders are so difficult to classify because human emotion is such a big part of growing up.
Right.
And a school environment puts you in a position where you're like going through transition, and socially you need to adjust and you need to change. So there is a DSM-5, which is a criteria that in medicine we use because we like to say you've got this, 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 and this, and therefore your diagnosis is this. In psychiatry, that's obviously a little bit more difficult, but obviously there are guidelines that say if you have, this many symptoms for this amount of time, before this age, in 2 different environments, then you have the diagnosis of ADHD. I don't think that's as important for parents and for schooling children for them to know that, but I think that they just need to know about the core symptoms and what to look for in their kids, and then if they're concerned, to present to a psychiatrist and an entire multidisciplinary team who look at the child from, a holistic view to make that diagnosis.
So it's more, so with regards to the diagnosis, it's we encourage parents or teachers not to do the DSM.
Right.
Because we basically look at a number of things. We look at, other things that might cause inattention. So there are a lot of other things that I think we're going to chat about that a little bit later. But it's you know, you get a history from the parents, you get a history from the school. I personally, if possible, if finances allow or resources allow, do a full educational psychological assessment. I certainly did that in my own children before they were diagnosed. Yeah. Just to collect enough information and to exclude other reasons for the presentation. I think that's important. Yeah.
Well, we're going to start crossing some of those things off the list, some of the other associated things that might go with this, just for all parents, because I can feel my heart beating just talking about this.
Calm down.
It's okay, man. I'm getting a little hyper here. Because as you might have picked up over the last 10 years, I do struggle to concentrate sometimes, so there's a little bit of that in me, but I think all parents are thinking very carefully about what to do if this does present in your child. So we'll get into how we can approach this and, of course, hopefully empower you to do something about it. This amazing, and I did say beautiful panel earlier. You are beautiful panel, are not going anywhere this morning. Please weigh in if you've got any insights or a personal perspective. 063 408 8863. This is a safe place. We'd love to hear from you.
It's my feel-good breakfast show.
Welcome back to your Tuesday morning on your feel-good breakfast show, Expresso on S3. Now, tomorrow is National Attention Deficit Hyperactivity Disorder Day, with the aim of raising awareness around this disorder and how to deal with it. And so this morning we're joined by a panel of experts, psychiatrist Dr. Laura Comrie, educational psychologist Danielle Douglas, and Dr. Michele Venzaghi, who are still here to chat through this with us. And of course, we encourage your questions. Please send them through to us via voice note on 063 408 8863, and we do have some voice notes.
Yeah, let's start it off right there. Let's hear from Monique this morning. Let's get her personal perspective.
Good morning, Expresso fans. This is Monique from Durban. My brother was diagnosed with ADHD. He was so hyperactive that they had to put him on a medicine called Ritalin. He was on 50 milligrams on the age of 13. And he completely outgrew it when he was 16. And today he's 22 years old. He's completely relaxed and completely chilled out. Thank you. Have a great day.
You too. Thank you so much for that, Monique. So there is hope there. Big word, Ritalin. We're going to be asking about that in just a moment. Let's squeeze in one more. This one's from Stella.
Good morning, Expresso. I've got a grandson that's 15 years old that has been diagnosed with ADHD, but this child is at that stage where he doesn't even want to go to school. He doesn't attend school regularly. He is on medication.
All right. Well, thank you very much for that, Stella. Some lovely insights there and things for us to kind of dig our nails into. And perhaps I can start off with you, Laura. Well, what I heard is a common thread of teenage years. Is that usually when one would expect for the condition to kind of present at its highest?
No, Danielle and I were just chatting now about our own experiences with ADHD. Generally, I have 2 kids and a husband with ADHD, asked not to be mentioned. But generally, you know, if you're more in tune with it, presentation is between, 4 and 8 years old, generally. Okay. So teens are quite late to present, but as we said, it's a spectrum. And so, the more severe part of the spectrum, we see earlier on, and early intervention really is the key, and then perhaps later on, one's more the inattentive, or somehow it's been missed, or there've been other coping mechanisms that have been used. People might present later on. And in my practice, I think because I have a lot of experience with ADHD personally, and, I almost call it peeling of an onion. So you peel off, treat the depression, treat the anxiety. I'm seeing a lot more adults with ADHD and diagnosing a lot more adults. So presentation is generally earlier on in the early primary school, and then, we pick it up at different points.
I suppose, a 13-year-old boy can be a wrecking ball, and I think that may be why this presents quite extremely in that space.
Yes.
As the kids get older, they become less manageable. How do you tell a 13-year-old, force a 13-year-old to go to school if they're pushing back at every turn? I get
and
that.
to take medication.
Well, this is it. I'm so glad you used the word medication. Michaela, maybe I can put this to you, Doc. Ritalin was a terrifying word when I was a child because I think it was being used so liberally, and maybe we didn't fully understand what ADHD was at that stage. Is this still the first go-to, or how do we approach treatment once we have gone through an exhaustive process of identifying where the child is in their own kind of journey in the space? How do we treat?
So I think what we're touching on here is the whole point of this day is to create awareness, you know. And often people come to me and they say they've noticed that there's been an increase in the amount of diagnoses of ADHD, or like you said, it's generally seen in older kids, but because there's awareness and people are starting to understand the disease better, the diagnosis might be made more regularly, or in the earlier phases. You know, in medicine we always say we like to take a multidisciplinary approach to every disease, but I think this is probably the cornerstone of where, you know, treatment is not only medication. The role of Ritalin and the role of Concerta, obviously, I mean, like you said, there's stigma attached to it. People misuse the medication a lot, and I think that adds to the stigma of Ritalin. But someone who's got ADHD, you know, the neural cognitive disease requires something that can help them to settle that.
Makes sense.
So, you know, there's no specific case that's going to say this person definitely needs medication, but I think that every case is an isolated psychiatric, psychological assessment, and saying, like, this person definitely needs Ritalin, but in addition to that, they're going to need, you know, cognitive treatment and support from the entire team as well as their parents. And the school, I think, is also a really important player in that.
I'm just thinking of the poor creche and the nursery school teachers that have to be that frontline defense when this starts to emerge. I really do get that. And I think it's also about giving the tools to be able to cope. When you talk about multidiscipline, for instance, in my case, being introduced to martial arts really young gave me a way to control that energy and channel it. Wasn't a cure-all, but it certainly did help, and it empowered me, and it certainly empowered my mom to be able to do something about it. Keep those comments coming. Great voice notes already. 063-408-8863. We'd love to hear from you. But I think it's time to get back in the kitchen, do something that boosts the mood, and get into a bit of cooking.
It's my feel-good breakfast show.
Welcome back. It is your Feel Good Breakfast Show Tuesday, and it is a health-focused Tuesday because tomorrow we are looking at ADHD Day, where we are creating awareness around the country because it's a national day of awareness. We've got a panel of experts in psychiatrist Dr. Laura Comrie, educational psychologist Daniel Douglas, and Dr. Michaela Venzagi, who are still with us. And Debbie has sent us a voice note. Let's have a listen.
Good morning. I have a granddaughter. She's 6 years of age. She has all the symptoms. Can you please tell me where do I go to get her diagnosed, please?
All right. Thank you very much for that, Debbie. Daniel, perhaps you could take us through the steps of where to start and what to follow, what course of action.
Well, I was thinking now, where would she go? It obviously all depends, you know, what's available to you. Do you go private? Do you go government? If you go government, depends on your area. Are you going to go to Red Cross? Are you going to go to Tygerberg? There's lots of factors at play as well. But if you had the opportunity to go private, then Laura made a good, mention earlier that it's a good idea to get a thorough assessment. To try to understand, like you were saying, if there's anything underpinning that. Is it really authentic ADHD, or is it something else that's manifesting as ADHD? So if we can tick off all the boxes and say, well, maybe it's a learning difficulty. You know, are they struggling to pay attention in class because learning is hard? So what is it? So you have to do all your, checks and balances and see, is it really what we're looking at? Is it really ADHD, or is it ADHD and something else?
An anxiety.
An anxiety.
And then for somebody who doesn't perhaps have access to private healthcare, what would be the steps to follow there?
Definitely go to your local clinic.
Okay, local clinic, and they will then refer you.
And they will then guide you.
The specialist that you need to.
Perhaps, sorry, just to interrupt, perhaps starting with the teacher first might be a good idea. And maybe asking the teacher if she's also seen this. And then, if there is someone at the school who can write, it's always quite nice to have a referral, so it's not just the nagging mom or grandmother.
Well, you're a team. Ultimately, you're a team, and
Takes
you
a
need to be
village, right?
empowering. Yeah, no, completely. And you need to be empowering your children's teachers. You should have that kind of relationship with them, and you should be able to talk to your children about these things and help them develop the language so that they can actually articulate what they are experiencing. Because I'm finding that more often than not, I am misdiagnosing what's going on in my little people, and because I haven't taken the time to fully establish. And often it can be something like, she's hungry. We often miss these things because we get swept up. Doc, maybe I can put this to you, Michaela. What goes through your mind when you're starting a treatment plan? What can we brace for? Are there side effects with these kinds of medications? Are there often secondary knock-on effects like a depression, for instance, once you're moving out of a manic, crazy state of hyperactivity? What are those possible side effects when it comes to the treatment of ADHD?
Yeah, so I think, as with all things, when you start treating something, many people have an expectation that there's going to be a dramatic change immediately. Ritalin is obviously a very short-acting drug, so that we do see significant improvement in symptoms very quickly. I think Laura probably would know a little bit more about, in terms of, what Ritalin, what to expect if you give your child Ritalin or Concerta, and how quickly that you establish that. It's so difficult with ADHD because, like, when do you say this person is cured? Or, like, it's so difficult because it's behavioral, it's psychosocial, there's interpersonal reactions, and our emotions have such a big role in how we interpret our kids' behavior as well. So I think that's a big thing. Obviously, all medications have side effects, from mild to massive side effects, but it's very difficult. It's so individualized. Not everyone gets all the side effects. Some people get
That's almost the most important
effects.
thing to focus on, is the fact that every
Completely.
child is going to be.
And I think the most important thing is to look at the kid and just say, what are you battling with the most, or what are we all battling with the most? I've got 2 kids with ADHD. They present in completely different ways, and it's completely individual. And people have different needs. So you might have a kid who is finishing at lunchtime at school, and they don't have much after school that they need to focus on. So then starting with a short acting, once you've excluded Ritalin, which would last 3 to 4 hours. So, it's kind of methylphenidate is the active ingredient, and then it depends on how long you need the medication for. I suppose, I grew up in a very natural, holistic family, and my feeling with the way I work is, the least possible medication for intervention, but the medication can be life-changing. So because of all these other knock-on effects. So just with regards to the medication, it depends how long you need it for. But generally, as kids get older or adults, you will need it to last a whole day. The big concern that a lot of parents have is the appetite suppression. And generally, what happens is that the kids, you get them to eat in the morning, they're not that hungry during the day, and then they are ravenous. Some kids battle to maintain the weight, but generally it's not such a problem. There has been some concern of maybe not, maybe not growing as they should, but that's not something that I'm worried at all. I think not treating severe ADHD is a lot more detrimental. There are a whole lot of other things that happen, and it's got to do with, like my son described having brain breaks. So literally he would sit in class and stare out the window, and he would catch about 10% of what was going on. Luckily, he's bright kid, so he was doing well. But imagine that it kept on going on. Imagine his confidence.
Yeah, absolutely.
And the first thing you want to do is punish him for not concentrating.
Yeah.
And I get that. I completely get that. I wish we had hours to be able to talk about this, and the 3 of you on speed dial. Wait, hang on a minute. I think I might have the 3 of you on speed dial. We might just utilize that. But I'm so glad you mentioned the fact that your son experienced something like that. And we forget this is not something that's happening to us. We get the knock-on effect, yes, but this is happening to our children. Imagine being caught in that, in the maelstrom of emotion, not being able to concentrate, to have that added pressure. It must be exhausting. So let's help our kids. We have the opportunity. We have got ADHD Day tomorrow, which is quite ironic that it's that long for this particular disorder, but that's what we are hopefully filling you in and empowering you around today. So please keep those voice notes coming. If you have a perspective, we'd love to hear from you.